Hi, you will be going for a fibroid surgery, or you must have done a fibroid surgery, and some things are happening to you and you cannot really explain, and you're not really getting that explanation as to why these things may be happening to you. So if you are planning to have your fibroids removed, these are some important things you should know that may likely happen inside the surgery and then after the surgery. Okay. During the surgery, you may be quite lucky to have maybe just one singular fibroid that may not even be encroaching the cavity of that womb where you menstruate from, and it's removed, repaired, and the surgeon comes out of it. Okay. But if during this process of the surgery there is a need for removing some fibroids that have encroached that cavity, the womb has a cavity, and that's where you menstruate from, then it is very important that after the surgery, the surgeon is going to tell you that they're going to put something like a loop or a catheter into the womb that you're going to carry for at least 10 days. It's going to help the womb maintain its cavity so that it doesn't come together, what we call adhesion. You get where I'm coming from? So that catheter is going to stay there for 10 days, and then at the end of 10 days, they're going to give you some hormonal drugs after removing the catheter or the loop or the IUCD device, whichever they are using for you, okay? And then they are going to give you some hormonal drugs that would help to regulate your menses and then help the womb to start menstruating. Do you understand me? Now, you may also experience severe pain during menstruation. That is if you are not the type that have painful menses, that's dysmenorrhea, prior to your fibroid surgery. But because your womb was scarred in different places, okay, and it's trying to heal, whenever you see your menses, you have this intense pain that you may not have experienced before. So it's something that you talk to your surgeon, and then they may give you some medications that would help with pain during menstruation, especially following fibroid surgery. As you heal, the pain tends to wane down, except, like I said, you've always had that painful menses even before the surgery. And then for those who are trying to get pregnant following a fibroid surgery, some of us will advocate at least 6 months to enable you heal, but some persons can even go at least 3 months. But the reason is that you need your womb to heal, and then probably if there may not be need for an operation during your delivery, you can actually deliver on your own. Do you understand me? So I believe there may be other things you may want to ask that you would want to understand following a fibroid surgery. These are the experiences I've had. I would help you, put them in the comment section. I would help you to explain them and then get a better life. Okay? Have a lovely day.